develop serious infections or injuries in their feet and legs. Complications from diabetes are classified as microvascular disease when the smaller blood vessels that supply the eyes and the kidneys are affected, macrovascular disease when large blood vessels that supply the brain and the heart are affected, and diabetic neuropathy when the nerves are affected. Typically affected are peripheral nerves, which supply sensation and touch, and autonomic nerves, which regulate internal functions. Single or focal nerves can also be affected. Not everyone who has diabetes develops complications from the disease. Why are some people more prone to complications than others is not clear. However, blood sugar levels that are persistently above the safe range damage blood vessels and nerves, increasing the risk of developing one or more complications. In addition, the longer someone has diabetes, the greater the risk for complications. Diabetes damages the lining of the blood vessels, causing them to become clogged with hard, fatty deposits called plaque. This is atherosclerosis. Diabetes also increases the pressure in the blood vessels, resulting in hypertension. When small blood vessels that surround and feed the joints and fibers that hold, bind, and support body tissues are affected, it can lead to joint and connective tissue damage. Diabetes also decreases or completely blocks the movement of nerve impulses or messages through organs, legs, arms, and other parts of the body. Treatment for complications focuses on stopping or at least slowing the progression of the damage. Keeping blood sugar levels within a safe range is the key. A balanced diet, regular exercise, medications for diabetes, and possibly insulin injections can help keep the blood sugar levels within a safe range. If a client has high blood pressure or high cholesterol, taking medications for those conditions will also help prevent diabetes complications. Frequent medical checkups are the key to evaluating the client for signs of complications. If they are detected early and treated aggressively to reverse or stop them, or at least to slow their progression, the client can still live a long, healthy life. When complications are found early, minor changes in the treatment plan might be enough. For example, if early signs of kidney disease are noted, the client might need an additional medication and have more blood or urine tests done more often. If treatment is inadequate and the client's blood sugar levels stay above the safe range over a long period of time, damage to blood vessels and nerves will progress. This damage can have permanent effects on the client's life. It can lead to serious disabilities, such as kidney failure or blindness, or death from a severe heart attack or stroke. Let's use another client situation to clarify the care of a client with diabetes who has complications. MV, a 76-year-old who has type 2 diabetes, injured his right great toe while walking to the bathroom during the night. Poor healing of the injury with subsequent color change followed. The toe became a dark bluish-black color. He reported a loss of sensation in the foot. Because of peripheral vascular disease resulting from diabetes, the toe had to be amputated. Prior to hospitalization for the surgery, MV was taking an oral hypoglycemic agent to control his diabetes. Due to unstable blood sugars, regular insulin was ordered QID, with dosages determined according to a sliding scale. 2 days after the surgical procedure, he was transferred from an acute care facility to an intermediate care facility. Now let's try to answer some of the questions related to this situation. The physician's orders on admission include glyburide 1.5 milligrams PO BID, Humulin R SC 30 minutes AC and HS according to the following scale, glucometer checks QID at AC and HS, fasting blood sugars weekly, vital signs QD, 2,000 calorie ADA diet. The nurse on the night shift reports that MV's glucometer reading at bedtime was 185. He received 5 units of Humulin R SC. The nurse further states that MV did not sleep well during the first night after admission. He was found wandering the hall on 2 occasions and was assisted to bed after voiding a small amount. Rank order the following actions the nurse should perform to prioritize care for the client. Check capillary blood sugar via glucometer, check vital signs, administer the client's morning medication. Provide breakfast, assist the client to the bathroom. Question: the client's tympanic temperature is 98.2 Fahrenheit. That's 36.8 Celsius. Pulse rate is 68 and respiratory rate is 16. The nurse compares the medication administration record with the supply of glyburide, labeled 3 milligrams per tablet. MV eats about 3/4 of his breakfast. His blood sugar measurement is 100 milligrams per deciliter. He voided 100 milliliters of dark, malodorous urine.
Given his current data, which is the most appropriate nursing action?
Withhold the glyburide due to low blood sugar. Administer half a tablet of glyburide. Administer 1.5 tablets of glyburide. Check the blood sugar 30 minutes PC. The correct answer is administer half a tablet of glyburide. Based on the preceding information, the nurse adds what nursing diagnosis to the client's plan of care? Sleep pattern disturbance. Rank order the potential etiologies for the client's nursing diagnosis, with 1 the most likely and 4 the least likely. Urinary retention, unfamiliarity with the environment. Hypoglycemia, hyperglycemia. The reason for MV's night awakenings might be best determined by which diagnostic information? CBC, Doppler ultrasound of peripheral arteries, glucose tolerance test, urinalysis. The answer is urinalysis.